super, super grateful. Hey there, we are talking autoimmune disease today and how hormonal birth control is correlated with an increased risk of developing autoimmunity. I'm Dr. Jolene Brighten. I'm the author of Beyond the Pill, a women's hormone expert, and the leading authority on post-birth control syndrome. Now, you may not have been told by your doctor that hormonal birth control can and does increase the risk of autoimmune disease. We're going to talk about how does that happen? Why does that happen? What's up with our hormones when it comes to autoimmunity? Because that is a big reason why women are the number one at-risk population of developing autoimmune disease. So, I am doing a whole lecture series with Rebel Health Tribe, and that is something that you can catch. And I will share the links to that where I'm doing an entire over an hour lecture on autoimmune disease. So I'll share that with you. But I wanted to jump on today and chat a little bit about this. Now, with hormonal birth control, it is well understood that there is a correlation with the development of lupus, multiple sclerosis, interstitial cystitis, that's what we think of as leaky bladder or painful bladder syndrome, and Crohn's disease. Now, there is a correlation with ulcerative colitis as well. However, with ulcerative colitis, the studies are a little bit tricky because a lot of these women were smokers. And if you smoke, that can put you at risk for inflammatory bowel disease as it is. Now, there was a study that came out of Harvard that showed us if women have a family history of autoimmune disease, specifically digestive autoimmune disease like Crohn's, ulcerative colitis, there's a 300% increased risk of developing that autoimmune disease after 5 years on the pill. This research was specifically looking at the pill. And the big reason for that is because that's the one you pop in your mouth and you take it into your tummy, and it should get absorbed in your small intestine. As it turns out, some research has shown that as much as 50% of that birth control will not be absorbed and actually will be handed to the microbiome in your large intestine to deal with. And this is where we get into trouble. This is how hormonal birth control actually lends itself to lowering microbial diversity, so the number of good gut bugs that are there, and can really decimate like those good guys that you have growing in your gut. Now, with this, it's really important to understand that as the research has evolved with the gut microbiota, we have come to understand that they are everything in our health, like our entire being of being healthy. But also within your gut lives your immune system. So the majority of your immune system lives in your gut. If your gut immune cells perceive that there are trouble, whether that be parasites or increase in yeast overgrowth or dysbiosis, not enough of the good gut bugs, that can get the immune system a little bit hot and bothered. So as we continue this conversation forward, one thing that I need to explain to you is how does autoimmune disease develop? Because if you understand how does autoimmune disease develop, then you can understand the role of hormonal birth control. So with autoimmune disease, Dr. Fasano, he defined this. He gave us the 3 ingredients of autoimmunity, which if you've read Beyond the Pill, you've read about this and what those 3 ingredients are. Number 1 is genetics. We need to have the genes for that disease. So I have the genes for Hashimoto's. That's why I developed Hashimoto's, which is an autoimmune condition that affects my thyroid. That is the number 1 autoimmune condition that we see in women. So there's nothing special about me in that. I'm just one of the many in our society walking around with Hashimoto's. Now, with that, we've got to have the genetics, and the genetics really determine like what comes next in terms of the ingredients, how you will present that. So ingredients go genetics. Then we also have to have leaky gut or intestinal hyperpermeability, as it's called in medicine and in the research. That is basically that you should have intestinal cells that are nice and tight together, but instead they have separated a bit, and now bigger proteins are getting through. So food proteins, parasitic proteins, yeast proteins, viral proteins, things that your immune system was never meant to see in that big of a form. And the trouble is that these proteins have amino acid sequences. So we're going to nerd out for a second here. You take 3 amino acids and you put them together and you've got a peptide. And that is what your immune system, your antibodies pick up on. So these proteins that get through can activate the immune system, that can lead to autoimmune disease. And they can also participate in what's called molecular mimicry. And that is, so Gliadin is the best example that we can use here to help you understand why people say avoid gluten if you have an autoimmune disease. So gliadin is a protein within gluten, and that protein's amino acid sequence looks enough like your tissues to trigger autoimmunity. So with that, it can trigger Hashimoto's, so it does look like your thyroid, but it also can trigger psoriasis because it also looks like your skin. And that is molecular mimicry. Basically, your immune system's a little bit confused, and it's like, you're trouble, you're close enough to trouble, someone's just going to call you trouble, and let's keep it safe. And that is how gluten can be a triggering event for some people. So the ingredients, genetics, then we've got intestinal hyperpermeability or leaky gut, and the triggering event. Now, the triggering event might be an acute stressor. Someone might die, you might get in a car accident, or maybe you got gluten exposure, mix it in with some pesticides, and now we've got like immune system chaos going on. And triggering events can also be shifts in our hormones, which is part of why women are more susceptible to autoimmune disease. So whether you're starting your period for the first time, you've lost your period because you're in menopause, you're in perimenopause, you got pregnant, you had a miscarriage and abortion, or you actually gave birth, you started or stopped hormonal birth control, all of these can be a triggering event that can turn on the autoimmune condition. So again, how you're going to present is going to depend on your genetics. And if you understand that, then you can understand that if your doctor says, well, there's no study specifically showing that, for example, having antibodies to your parietal cells or antibodies, so you would end up with like atrophic gastritis or pernicious anemia. Like there's no study to show specifically birth control causes that. It really doesn't matter. You just have to use a little common sense of how does autoimmune disease develop and understand that while we are seeing the correlation between lupus, multiple sclerosis, interstitial cystitis, and I talk about all of this in Beyond the Pill, by the way, and I certainly have seen a correlation with Hashimoto's as well, although the research is lacking to substantiate that, to say there is causation there. But if you understand that birth control messes with your microbiome by way of doing that, it messes with your immune system, it lowers microbial diversity, and increases intestinal hyperpermeability, and it can be a triggering event for autoimmune disease, then you can see that it is possible that you could develop an autoimmune condition from being on hormonal birth control. Now, there's a few things we got to talk about that most docs don't get about autoimmune disease. In fact, I meet with patients all the time who are like, my rheumatologist or my neurologist, they're like, you either have autoimmune disease or you don't. I actually heard from someone the other day where their neurologist said, like, you either have multiple sclerosis or you don't, and you don't go on to develop multiple sclerosis. To which I say, it's time for you to go to an immunology conference and get up to date on the research. So here's how autoimmune disease goes. And if you understand this, then you can understand when you can reverse things and when it's gone a little bit far enough that you got to consider a drug. And sometimes we have to consider drugs in autoimmune disease. So the way autoimmune disease develops is it begins with the antibodies. So your body may start with IgA as in apple antibodies, which is like, I'm thinking about attacking you. I haven't decided yet. I haven't made up my mind. Or there can be IgG antibodies where it actually class switches into a permanent state of the immune system that's like, it's on. Like I have decided to throw down. So with that, this is why I talk about in Beyond the Pill to use the Cyrex Array 5 testing, which you can look for IgA antibodies and IgG antibodies to your immune system. Classically, what your doctor is going to test is going to be IgG, as in goodness, I have an autoimmune disease, IgG antibodies. So with that, I like to use the analogy of like a rainbow. So hopefully time going on. Okay, so we've got a rainbow. We've got the base of one rainbow, and that is where the antibodies are starting. And so we start to have antibodies developing. We know that some autoimmune conditions, like Addison's disease, you may see a 21-hydroxylase antibody come up positive, and we know that that's predictive that within 10 years you will develop that autoimmune condition if you do nothing about it. So on one end of the pot of gold, we develop antibodies. And over time, we begin to have symptoms creep on. When do we usually end up at the doctor? At the peak and the top of the arc of the rainbow, where symptoms are now disrupting our life and we are concerned. So in all this time, your immune system was already thinking about going there, starting to go there. Now the tissues are breaking down. Now you have symptoms. Now you see your doctor. It may be at this point that they're like, yes, you have autoimmune disease. and it's bad enough that we need to start a medication with your symptoms. For example, if you've destroyed enough of your thyroid tissue with Hashimoto's and you are hypothyroid, you will need a medication. You cannot live without this hormone. You were born always needing thyroid hormone. If you've destroyed the tissue enough, you may have to replace it with a synthetic or bioidentical hormone replacement therapy. But with that, a lot of times doctors will be like, you have the antibodies, you have the symptoms, but not all of the symptoms, or it's not bad enough to do anything about it. Let's just watch and wait and we'll monitor. Because what are they waiting for? They are waiting for you to get to the other side of the rainbow where symptoms are so bad that we've had tissue changes that are irreversible. So with rheumatoid arthritis, that may be deformities in the hands and the other joints, at which point you can't change that. You cannot reverse the tissue destruction that's happened there. And that is time that when things have gone far enough that you get big gun drugs, okay? Now, if your doctor only knows how to work with big gun drugs, these are the immunosuppressants that are linked with cancer, that's what they're going to use. But they also know that there are major side effects with that. And they've got to make a decision. Does the risk outweigh the benefits? And if the risk does not outweigh the benefits, it's a watch and wait situation, which is where naturopathic medicine and functional medicine work a lot differently. I want to see people's antibodies who are thinking about going there so we can just say bye-bye to those and not ever go there. I want to see people who are getting the symptoms. I want to see people before we get to overt tissue destruction, because there's so much that I can do in that time and teach them to be able to put the autoimmunity in remission, because yes, that is 100% possible, and make sure that we don't go into that irreversible tissue change like we see with rheumatoid arthritis, Hashimoto's thyroiditis. Every autoimmune disease, your immune system is destroying your tissues. And so we want to get ahead of that sooner than later. Now, sometimes people will say things like, well, I have Crohn's disease. And I've actually had people say, it is harmful that you tell people that they can put their autoimmunity in remission. And because they have flares, that means it's not possible. No. Okay, so one is, I've had patients who have proven doctors wrong time after time. You guys know I don't use the word proof lightly, that yes, they can put their autoimmunity in remission. But there's problem in that logic when someone says, you can't put it in remission because you have flares and you may need a drug again. You know what it's called? It's called life. That's called freaking life happens. And like I said, the trigger could be a car accident. The trigger might be losing your job. Your trigger might be losing your loved one. You know what all these things are? Things you can't plan for, things you never saw coming. And that insult might tip the scale so that your body flares again. Does that mean that you're forever stuck in that? No, it means there's an opportunity to heal that again and come back to that. But, just because your body has went there once, it absolutely does mean it's tempted to go there again, but it doesn't have to last as long, and it is possible. So whenever I'm working with someone with autoimmunity, we have an acute, and especially with inflammatory bowel diseases, we have an acute protocol, and we have the long game protocol of the root cause stuff. So that if flares come up, they know exactly what to do about that. And as you guys may know, I have autoimmune disease. My son also went on to develop an autoimmune disease that affects his brain. And we are still in the healing phase of that, which means that some days we are sky high, everything is going well. And other days, I just want to pull my hair out and run away, because I'm like, it is that freaking hard to mother a child with pandas. And that's the real talk that happens sometimes. No, I don't run away. I do. I would be lying if I didn't say I wasn't tempted sometimes to be like, I'm just going to walk out of this house for 5 minutes and come back later. So here's the thing. With birth control, as we talked about, it can be a triggering event. It can also be the obstacle to healing your autoimmune disease, right? If something is inflammatory, causing blood sugar dysregulation, by the way, that's going to set off your immune system. That can also be a trigger. It's chronic poor lifestyle and diet habits. But with that, it may be impacting your ability to heal. I mean, just by way of the fact that it depletes nutrients like vitamin A and zinc that are needed to regulate your immune system could prevent you from healing. Now, does that mean that birth control is the devil and nobody should take it? No. But you should be informed about this. If you know you have a family history of autoimmune disease, you want to just check yourself before you pop that pill or place that patch or get that depot shot, and just say like, hey, has anything been going on for me? Or like, maybe should I consider something else? Or like, should I monitor some symptoms first? This is ideal if you're going to start birth control. Monitor your symptoms first and then go and start birth control and then continue to monitor symptoms. But, just because we have this information doesn't mean that like, oh, that means no one can take birth control and birth control is the worst thing ever. But it means that we need to be informed. We need to be informing women about this possible risk for autoimmunity. So what to do right now if you're on hormonal birth control? So number one is you've got to start looking at how you're feeding yourself and feeding your microbiome. Regular meals, making sure you have ample vitamin D coming in. Omega-3 fatty acids are definitely a must. If you're looking for a clean supplement source of omega-3 fatty acids, please check out my Omega Plus. And looking at how can you incorporate foods that are going to feed your microbiome. So making sure that you have a variety of fibers coming in, making sure you're eating plenty of vegetables, and you may even want to consider using something like my gut rebuild supplement, which has L-glutamine in it, aloe. It also has some cat's claw, zinc carnosine specifically is the zinc you need to heal the intestines. But all of this to kind of help mitigate the effects of birth control on leaky gut. And if you're like, whoa, I need more information on all of this, Beyond the Pill, you can grab that book, and that is going to have information on birth control, your hormones, and what is up with autoimmune disease. That's been a big aha for a lot of women. They didn't know that my book was going to talk about autoimmunity. I was like, how can we not talk about autoimmunity? It is a central women's health issue right now, given that we are developing autoimmune disease as women at a higher rate than men, and just autoimmune disease is exploding. I see Serena has a question, so we'll dive into questions now. Is there a connection between endo and autoimmunity? So the research is looking more and more like endometriosis is an autoimmune disease. However, not me, if I had my choice, I would do this differently, but researchers have not done their due diligence, and women's health has not had the respect it deserves in actually researching this so we understand what endometriosis is and how it develops and how we can be preventative about it. When you consider that 1 in 10 women are impacted with endometriosis, it is a disappointment that medicine and research have not been investigating this further and really understanding what is happening for women. So there seems to be an autoimmune link. There is a link to the gut, like everything going on. And with endometriosis, there's likely a genetic predisposition. But there are also people questioning the role of environmental toxins in that. And environmental toxins seem to be able to work around that genetic predisposition and cause disease in people that you wouldn't anticipate seeing disease in. And genes are great to know, but they're only like one piece of the puzzle. You took the test in Beyond the Pill, and I'm not sure if I have too much cortisol or not enough. Which one should I focus on? So Summer, I want to encourage you to go watch the video. It's on YouTube, and it's also on Instagram, and it's on Facebook. So it's on IGTV. And that video is on the quiz results. And I talk about how you can have high and low cortisol symptoms all at once and exactly what that means and what to do about it. Do mold and parasite testing tie into this? Yes, 100%. So both of those, both mold and parasites can upregulate the immune system and can be inflammatory. And anytime, so getting sick is a good thing, you guys. Like, although, the media and commercials and even some doctors would tell you that, oh, you should never be sick. Like, that's the standard. That is wrong. Shut it down. Like, that is not how like humans or animals in general go about life. Like, why do we get sick? Let's talk about that. We get exposed to a virus. The virus doesn't make us sick. Our immune system don't spread this, and you need to rest so that you can heal from this. So we get cranky. We don't want to be around people. We're super fatigued. And then you have the other symptoms. Like sometimes you get a rash. Sometimes you have a sniffly nose. Sometimes you have a sore throat. There's ways that these things show up. Infections are not bad. Yes, they can get out of control. But whenever a patient comes in, and like people will do this where they wear it as a badge of honor and they brag and they're like, I never get sick. I haven't been sick in 5 years. I'm like, crap, we got to look for the autoimmune disease, or like, are you brewing cancer, or what is going on? Because that is a sign of immune system dysfunction. Like, there is a way that your immune system is meant to operate, and giving it something to do, like getting exposed to viruses, bacteria, and letting it, even parasites, letting it do its job is a really important way of building true immunity. The only way we build true immunity is by getting exposed to these organisms. And so that's part of your immune system's like learning, is that it becomes immune to these. But then things go awry. Like, we get exposed to Epstein-Barr virus, which, by the way, you guys, I just want you to understand something that seems to be like lost in translation right now. And that is, your DNA is 1% viral. Like, you are viral, okay? We have evolved with viruses. They insert themselves into our cellular machinery. They become part of our DNA. We don't clear Epstein-Barr viruses or these viruses for good. And there's a lot of evidence starting to come out about how getting these viruses it's so important to our overall health. We know there are studies where children who have autism and they get sick and they have a fever and they get exposed to these viruses now can function and speak while they're sick, and their immune system's doing its work. There is information coming out about some of these viruses that everybody's afraid of in the news that are like, and it actually helped with brain cancer, and it actually helped with this neurological issue. We don't understand enough about the immune system to be waging war on everything, or to be coming in so cocky thinking that we know everything. But with Epstein-Barr virus, what can happen and go awry? You get Epstein-Barr virus if you have vitamin A and zinc, and you've got vitamin C, and you've got like your nutrient stores on point, and you actually take the time to rest. Like, you can put that virus into remission and it doesn't become an issue. But if you try to plow through, and this is really the problem, right, in society, is that we are told that like we should never get sick because it's basically inconvenient to your life. But what is that all about? It's about driving you to work yourself to death. It is saying that like, never get the flu, never get anything so you can always work every single day. And in the United States, for example, we are not set up for sick pay, let alone maternity leave, and these things we need to take to recover our body. It's all propaganda to make you work yourself to death. Now, if you have all of your nutrient status on point, you take the time to rest, you eat whole foods, you care for your body, you can handle these viruses. You can move through them. That is, if you're not immunocompromised. And it gives your immune system something to do. Like it gets to do its actual job. Now, with all of that in autoimmunity, there can become confusion. And what I see often in patient stories and timelines is that this confusion arrives out of a place where they're like, yeah, and I just powered through and I drank like 4 cups of coffee and I went to work anyways. And like, I, knew I should have rested, but my friends were going out that night and I had FOMO and I didn't want to miss out. Or, I had been binging on fast food and not sleeping for weeks. And then I finally got a good night's rest and I got sick. And it's like, you were essentially defying the laws of nature that govern your body. And you got your comeuppance for it. And I say this as somebody who's gotten some comeuppance, because I'm A-type is all hell, you guys, where I'm like, I get upset when I have to take a day off of work because I love what I do so much, but it's there to slow your roll and help you have a little bit of a reset. So that was a little bit of a rant, but I hope that was helpful. You love my outfit. That's awesome. Thanks. So with that, you love learning. Okay, good. And talking about HPV, human papillomavirus is the #1 sexually transmitted infection. At drbrighten.com, I have an HPV article for you there. There's a lot of ways that we approach HPV. And if you understand in the research, and this has been like a long time out, most of us clear HPV. It's why we're not doing pap smears every single year on women, because you know what that was resulting in? It was resulting in women having their body parts hacked up with no medical evidence to support us doing that. And we get all afraid of HPV, and there's a risk of cancer with all of that. It's a virus. You know what your body's really good at doing? Putting viruses in remission. And so I've helped a lot of women be able to put their HPV in remission, have clear pap smears. Your immune system is set up to do this. So Serena says, I'm a bit confused as to how to figure out which autoimmune condition you could have. So you can do testing, like I talk about in Beyond the Pill. The Cyrex Array 5 is a predictive autoantibody screening. That is not, you're going to have to see a functional medicine or naturopathic physician for that. Your conventional doctor will not be familiar with it, and you cannot use that test to diagnose. And so with that, if let's say that like, I always double check my autoimmune testing. So let's say that like in your blood work, you have a positive ANA, an anti-nuclear antibody. And that's like a dirty screening is what I call it. It's just like a really like it's muddy waters. And you're like, maybe it's true, maybe it's not true. And we look at immunoglobulin status, and then we'll go a layer deeper and we'll look at 21 hydroxylase antibodies. And then if it comes back that it's like, okay, 21 hydroxylase, we'll look at the Cyrex Array 5, sorry. And if it comes back that there's positive 21 hydroxylase antibodies, that would affect your adrenal glands, but also can be involved in premature ovarian failure, what is now called primary ovarian insufficiency. And we see that there are antiphospholipid antibodies. We double back with like a LabCorp Quest, a general blood panel, and we test for that to see like, is that coming up? Because I can't diagnose you based on the Cyrex Array 5, but that can catch things way ahead of time. Now, the other thing is that we correlate the symptoms, and we start looking at the symptoms that are going on. And that helps us dial in what kind of autoimmune disease that we are dealing with. What kind of additional support do you recommend for people on your protocol that also require prednisone for their autoimmune flares? So can I slow down? Probably not. Sorry, guys. I think once a month we get somebody asking, like, can you talk slower? This is slow for me. And I laugh because my husband does this all the time too, where he's like, I know you're talking slow for you, but it's still ridiculously fast. I talk, it is hard. I'm so sorry, but it all lives in my book, Beyond the Pill. I'm sorry, guys. So if you're having to use prednisone, I just went through this with my son. This is why I laugh whenever people are like, you're anti-pharmaceuticals. And I'm like, I take a pharmaceutical every day myself. I have Hashimoto's, I take Nature Throid. And we just finished up prednisone with my kid a few months ago. And I'm like, thank God for prednisone. So with that, with prednisone, our concern is always the adrenal glands. And what you want to talk to your doctor about is, duration and dose. The higher dose, the longer you're on it, the more it can hit your adrenals hard. And when you come off of it, your adrenal function might suffer. And then the autoimmune flares again, you're back on prednisone. So working with your doctor of ways to support your adrenal glands while you're on it, something that will not interfere with prednisone, making sure you have a high quality B complex. So with my patients, we'll use the B Active Plus, and that will be in addition to like a multivitamin. What's really key in there is B5. And then the other thing is vitamin C. Your adrenal glands are one of the areas in your body that are highest concentration of vitamin C. And so we need to make sure we have ample vitamin C. If you guys don't know who Linus Pauling is, he's like the OG of vitamin C talk. And back when in his day, which is a long time ago, when he was talking about how important vitamin C was, people were, of course, because whenever you're onto something, like there's always the haters that are like, you're crazy. That's just crazy talk. And now everybody's like, oh snap, he was so onto something. Can we like let people like have their glory moment of being smart before they die? Like, what is it? Like an artist paints all these paintings and they're beautiful, but everybody's like, yeah, they have no value. Then they die. And then suddenly we appreciate them. Can we all make a pact to appreciate people before they die? This is another rant, but like, we just lost a really dear friend that's close to us who suddenly died of cardiac arrest. And it's something that like all of us who are friends with him are just reflecting on, like, our time is so finite and we never know when it's coming to an end. So let's just honor and appreciate everybody now. So with prednisone, there's the vitamin C, there's the B vitamins that will not interfere with those. You can safely bring those in and you can focus on your diet. So eating shiitake mushrooms and like having some fresh strum off of prednisone. We may want to consider adaptogenic herbs, things like licorice, but not being on licorice while you are on prednisone, because that can alter things. And that's really a conversation with prednisone or using herbs that were not indicated at that time. And there's no shame in using whatever medication or surgical interventions that you need to use to feel better now. So I just want to say that because sometimes people feel really bad because like they had to take thyroid medication or they had to do a round of prednisone or anything like that. And you really shouldn't feel bad. you ordered the Be Active Plus already, and you started the book 3 days. So I'm already on chapter 7. Oh, you started it 3 days ago. That's awesome. So I see any tips on how to lengthen your luteal phase? Yeah, go to my post on Instagram that just happened on Vitex. So I talk about Vitex. So there's a post that talks about Vitex. The one right before it, which is a picture of me, is also talking about low progesterone and what to do about that. And it's the funny thing on Instagram that I think I've just finally noticed this week is that if it's a photo of me, you guys don't tend to read it as much as it's just a word meme photo, like just a meme. And so you guys will ask questions. I'm like, oh, that post is right there. And then you guys are like, oh, I had no idea. I thought it was just a picture of you. I very rarely get on and just talk about me on Instagram. If it's a picture of me, I'm usually talking about something medically related. So you definitely want to check in on that. So I want to say thank you all for being here today. I always appreciate doing these lives with you. I hope this helped get some understanding around birth control, autoimmune disease, few tips on what to do about it. And again, if you have not joined the Rebel Health Tribe Autoimmune Masterclass yet, please grab the link that I have for you below and do that. That way you can get in on all of this. I'll be teaching a full class with slides and everything about autoimmune and birth control connection and how that ties into your natural hormones as well. So what you got to know about being off of birth control, going on it, or coming off of it. And there's a lot of great presenters on there as well for you to join. So thank you so much for joining me, and I will see you all next week.